Hello, my friends, my family, and my fans. I'm Andrew Ditch. I've been diagnosed with autism and intellectual disability. Today, I want to talk about a really important topic. This is very important for millions of other adults with autism. This topic shows how incompetent the medical and mental health field really is. You go to a doctor when something bothers you, like when physical pain, stomach problems, or even when your behaviors are not seen as the social norm. This is where I start with how incompetent doctors are in identifying autism and intellectual disability, and how they often can use masking as a way to misrepresent someone's behaviors as noncompliance or argumentative rather than part of their intellectual disability or developmental disability. What is autism versus dependent personality disorder, and how are they similar and how are they different? Below is a clear, structured, deeply accurate comparison of autism spectrum disorder, ASD, and dependent personality disorder, DPD. What each condition is, where they overlap on the surface, and the core differences clinicians look for when making a differential diagnosis. This version is designed to cut through the confusion that often leads autistic adults to be misdiagnosed with personality disorders. Glowing star: autism versus dependent personality disorder, DPD. Autism is a neurodevelopmental disability present from early childhood. DPD is a personality disorder rooted in attachment insecurity and fear of abandonment. They can look similar in a few superficial ways, but the underlying causes, motivations, and developmental patterns are completely different. What autism actually is. Autism is a neurodevelopmental condition involving differences in social communication, sensory processing, differences, executive function disability, need for predictability, and routine difficulty, with rapid back-and-forth conversation shutdowns and meltdowns under overload, masking and camouflaging, uneven skill profile, spiky profile. Autism is not caused by trauma, attachment patterns, or personality style. It is present from early childhood, even if not diagnosed until adulthood. Speech balloon: what dependent personality disorder actually is. DPD is a personality disorder involving excessive need to be taken care of, intense fear of abandonment, difficulty making decisions without reassurance, clinginess towards specific people, submissive or people-pleasing behavior, feeling helpless or panicked when alone, difficulty disagreeing due to fear of losing support. DPD develops from attachment patterns, usually in adolescence or early adulthood, not from sensory or communication differences. Magnifying glass tilt to the left: how autism and DPD can look superficially similar. Some autistic adults may appear dependent on caregivers, unsure how to make decisions, needing help with daily tasks, wanting predictable support, struggling with independence. This can be misinterpreted as DPD, but the reason behind these behaviors is completely different. Puzzle piece: core differences, motivation behind behavior. White medium star: autism. Behaviors come from sensory overload, executive function disability, communication differences, processing delays, need for predictability, difficulty generalizing skills, fear of making mistakes due to past misunderstandings. The motivation is neurological. White medium star: DPD. Behaviors come from fear of abandonment, fear of being alone, fear of losing support, low self-confidence, attachment insecurity. The motivation is emotional and relational. Brain core differences, social presentation. White medium star: autism. May appear independent, avoidant, or overwhelmed, may prefer solitude, may struggle to read social cues, may not seek reassurance, may mask distress, may communicate in a flat, monotone, or highly logical way. White medium star: DPD. Actively seeks closeness and reassurance, strong fear of being alone, clingy, or dependent on specific people, difficulty disagreeing, strong emotional expression tied to relationships. Core differences, developmental timeline. Autism, early childhood, dependent personality disorder, adolescence or adulthood. Autism, neurodevelopmental, dependent personality disorder, attachment-based. Autism, lifelong, neurological profile, dependent personality disorder, learned relational pattern. Core differences, independence and support needs. White medium star: autism. Support needs come from executive function disability, sensory overload, difficulty with multi-step tasks, difficulty with unpredictability, communication barriers. Support needs are neurological, not emotional dependence. White medium star, DPD. Support needs come from fear of being unable to cope alone, fear of losing relationships, low confidence in decision-making. Support needs are emotional and relational. Brain core differences, emotional regulation. White medium star, autism. Shutdowns, meltdowns, overwhelm, sensory-driven, panic, difficulty, identifying emotions, alexithymia. White medium star, DPD. Anxiety about abandonment, emotional distress, when alone, panic when relationships feel unstable. Brain core differences, communication style. White medium star, autism. Literal, direct, blunt, or overly formal, difficulty with rapid back and forth, may lose speech under stress. White medium star, DPD. Communication shaped by fear of upsetting others, people-pleasing, difficulty asserting needs. Brain why autism is often misdiagnosed as DPD. Because clinicians without autism expertise may misinterpret. Shutdowns, stonewalling, needing support, dependency, difficulty making decisions, submissiveness, masking, manipulation, sensory overwhelm, emotional dysregulation, executive function disability, helplessness. This is diagnostic overshadowing, and it is common. Glowing star, the core insight. Autism and DPD can look superficially similar in terms of support needs, but the underlying mechanisms are completely different. Autism equals neurological differences, DPD equals attachment-based personality pattern. Autistic adults need sensory support, communication accommodations, executive function, scaffolding, predictability, autism-informed therapy. People with DPD need attachment-focused therapy skills for autonomy, emotional regulation support. They are not interchangeable, and confusing them leads to harmful misdiagnosis. If you're interested in disability topics, such as treatment, support, accommodations, and rights, like this video and subscribe for more inclusive content. I will talk to you on my next video.